Here is a fact that should make every American senior angry. Right now, over 2 million Medicare beneficiaries qualify for a program that could reduce their prescription drug costs to $0, but they have never even heard of it. That is right. The government has a secret program sitting there waiting to help you, and nobody told you about it. The average senior spends over $4,000 per year on prescription medications. But what if I told you there is a legitimate Medicare program that could cut that number down to just a few dollars per month, or even nothing at all? This is not a scam. This is not some fly-by-night scheme. This is an official government program that has been around for years, hiding in plain sight. Stay with me because this could save you thousands of dollars. Let me paint you a picture of how bad the prescription drug crisis has become for American seniors. According to the latest research, nearly 30% of adults over 65 have stopped taking their medications as prescribed because they simply cannot afford them. Think about that for a moment. People are choosing between their heart medication and their grocery bill. The average Medicare beneficiary now takes 4 to 5 prescription medications every single day, and the costs keep climbing year after year. Brand name drug prices have increased by over 35% in just the past 5 years. One popular diabetes medication costs over $800 per month without help. Blood pressure medications, cholesterol drugs, and arthritis treatments are draining retirement savings accounts across America. This is a genuine healthcare emergency. The numbers get even more alarming when you look at specific medications that seniors need. A 30-day supply of a common insulin brand can cost over $500 at the pharmacy counter. Popular medications for rheumatoid arthritis run over $2,000 per month. Even generic drugs are not cheap anymore, with some costing $50 to $100 for a single prescription. Here's what breaks my heart the most. Seniors are cutting their pills in half to make them last longer. They are skipping doses to stretch their supply. Some are choosing which medications to take and which ones to skip this month. A recent survey found that 1 in 4 seniors has rationed their medications due to cost. This is happening right here in America to people who worked their entire lives and paid into the system. But there is hope, and that is exactly what I am going to share with you today. Now let me introduce you to the program that could change everything. It is called the Extra Help Program, also known as the Low Income Subsidy, or LIS. This is an official Medicare program run by Social Security that helps people with limited income and resources pay for their prescription drug costs. And here is the best part. If you qualify for full Extra Help benefits, you could pay as little as $0 for your prescription drug premiums. You could pay $0 for your annual deductible. And you could pay just $1.55 for generic drugs and $4.95 for brand name medications in 2024. Compare that to paying hundreds or thousands of dollars every month. The savings are absolutely life-changing. This program puts real money back in your pocket, starting from the very first month you are enrolled. So who exactly qualifies for this incredible program? Let me break down the 2024 income limits for you. For an individual, your annual income must be below $22,590. That works out to about $1,883 per month. For a married couple living together, your combined annual income must be below $30,660, or about $2,555 per month. Now here is something many people do not realize. Social Security does not count everything as income. They do not count your house. They do not count your car. They do not count your personal belongings or life insurance policies. They also do not count money you receive for food and shelter from family members. So even if you think your income is too high, you might still qualify. It is always worth applying to find out. Besides income, there are also resource limits you need to know about. For 2024, individuals must have resources below $17,200. For married couples, the resource limit is $34,360. Now, what counts as resources? This includes money in checking and savings accounts, stocks, bonds, and mutual funds. It also includes real estate you own besides your primary home. But here's the good news about what does not count. Your home does not count, no matter how much it is worth. Your car does not count. Your burial plots, irrevocable burial contracts, and furniture do not count either. Personal belongings and one vehicle of any value are completely excluded. Many seniors are surprised to discover they qualify once they understand what really counts toward these limits. Do not assume you make too much. The rules are more generous than you might think. Applying for extra help is much easier than you might expect. You have 3 simple options to choose from. Option 1 is applying online at socialsecurity.gov/extrahelp. This takes about 15 to 20 minutes, and you can do it from the comfort of your home. Option 2 is calling Social Security directly at 1-800-772-1213. Their representatives can help you apply over the phone and answer any questions you have. The phone lines are open Monday through Friday from 8 in the morning until 7 in the evening local time. Option 3 is visiting your local Social Security office in person. You can find the nearest office by using the locator on the Social Security website. Whichever method you choose, you will need to provide information about your income, your resources, and your current Medicare coverage. The application is free, and there is no penalty for applying, even if you end up not qualifying. There's another incredible benefit you might automatically qualify for. If you currently receive Medicaid, Supplemental Security Income, which is SSI, or help from your state Medicare savings program, you are automatically eligible for extra help. You do not even need to apply separately. Social Security will enroll you automatically. But here is something critical. Even if you are auto-enrolled, you should still review your coverage to make sure you are getting the maximum benefits. Some people receive partial extra help when they could qualify for full benefits with a simple application update. Also, if you get a letter saying you were auto-enrolled, make sure you actually sign up for a Medicare Part D prescription drug plan. Extra help covers the costs, but you still need to choose a plan that covers your specific medications. Your state health insurance assistance program, called SHIP, can help you compare plans for free. Let me share some real numbers that show the power of extra help savings. Without extra help, the average Medicare Part D premium in 2024 is about $55 per month. With full extra help, that premium drops to $0. The standard Part D deductible is $545 per year. With extra help, your deductible is $0. Co-payments without help can range from $10 to $50 per prescription, sometimes much more for specialty drugs. With full extra help, you pay just $1.55 for generics and $4.95 for brand names. Add it all up, and the average beneficiary with extra help saves over $5,000 every single year. That is $5,000 staying in your pocket instead of going to the pharmacy. Over a 10-year retirement period, we are talking about $50,000 or more in savings. This is real money that could transform your retirement security. Now let me warn you about the biggest mistakes that cause seniors to miss out on this program. Mistake number 1 is assuming you do not qualify without checking. I cannot stress this enough. The income and resource limits are higher than most people think, and many things you own simply do not count. Always apply and let Social Security make the determination. Mistake number 2 is not reporting changes in your situation. If your income drops or your resources decrease, you might newly qualify for extra help or qualify for a higher level of assistance. Report changes within 10 days by calling Social Security. Mistake number 3 is missing the application timeline. While you can apply for extra help anytime during the year, pairing your application with Medicare open enrollment from October 15th through December 7th ensures your benefits start January 1st. Do not wait until you are in a financial crisis to apply. Here are more costly mistakes to avoid at all costs. Mistake number 4 is forgetting about state programs that work alongside extra help. Many states have Medicare savings programs that pay your Medicare Part B premium, and qualifying for these programs automatically qualifies you for extra help. Contact your state Medicaid office to learn more. Mistake number 5 is choosing the wrong Part D plan after getting extra help. Even with extra help paying most costs, you still need a plan that covers your specific medications. Use the Medicare Plan Finder at medicare.gov or call 1-800-MEDICARE, which is 1-800-6334-227, for free help comparing plans. Mistake number 6 is not appealing if denied. If Social Security denies your extra help application, you have 60 days to request an appeal. Many initial denials are overturned on appeal when additional documentation is provided. Never give up after one rejection. Let me quickly summarize everything you need to do today. First, check if your income is below $22,590 for individuals or $30,660 for couples. Second, verify your countable resources are below $17,200 for individuals or $34,360 for couples. Third, apply online at socialsecurity.gov/extrahelp. Call 1-800-772-1213 or visit your local Social Security office. Fourth, choose a Part D plan that covers your medications using medicare.gov. If you qualify, you could start paying just $1.55 for generics and save over $5,000 every single year. Do not leave this money on the table. Now hit that subscribe button and click the notification bell, because next video I am revealing 3 more secret Medicare programs that could save you even more money. I will see you in the next one.